Marsha Blackburn, Tennessee.
Hey.
Thank you, Mr. President, and thank you for acknowledging that we have ideas on health care, because indeed we do have ideas, we have plans, we have over 50 bills, we have lots of amendments that would bring health care ideas to the forefront. We've got plans to lower costs, to change purchasing models, address medical liability, insurance accountability, chronic and pre-existing conditions, and access to affordable care for those with those conditions. Insurance portability, expanded access, but not doing it with creating more government, more bureaucracy, and more cost for the American taxpayer.
What happens when a Republican senator walks into a healthcare debate ready to challenge Barack Obama and instead finds the president turning the entire argument back on her? That is exactly what happened in this exchange. Marsha Blackburn came prepared with a long list of Republican healthcare ideas: lower costs, changing purchasing models, dealing with medical liability, increasing insurance accountability, addressing chronic and pre-existing conditions, expanding portability, and expanding access. From a conservative perspective, these are important principles. Healthcare should be affordable. Families should have choices. Small businesses shouldn't be crushed by rising premiums, and government shouldn't automatically become the answer to every problem. Blackburn's basic argument was that Republicans weren't simply sitting around saying no. They had proposals, amendments, and legislation that they believed could improve the healthcare system. And then she asked Obama a direct question: when are we actually going to sit down and work through these ideas together? That's a fair question, because here's the uncomfortable truth about Washington.
And we look forward to sharing those ideas with you. We want to work with you on health reform and making certain that we do it in an affordable, cost-effective way that is going to reduce bureaucracy, reduce government interference, and reduce costs to individuals and to taxpayers. And if those good ideas aren't making it to you, maybe it's the House Democrat leadership that is an impediment instead of a conduit. Right. But we're concerned also that there are some lessons learned from public option health care plans that maybe are not being heeded. And certainly in my state of Tennessee, we were the test case for public option health care in 1994. And our Democrat government has even cautioned that maybe our experiences there would provide some lessons learned that should be heeded and would provide guidance for us to go forward. And as you said, what we should be doing is tossing old ideas out, bad ideas out, and moving forward and refining good ideas. And certainly we would welcome that opportunity. So my question to you is, when will we look forward to starting anew and sitting down with you to put all of these ideas on the table, to look at these lessons learned, to benefit from that experience, and to produce a product that is going to reduce government interference, reduce costs, and be fair to the American taxpayer?
Actually, I've gotten many of your ideas. I've taken a look at them, even before I was handed this. Some of the ideas we have embraced and are in our package. Some of them are embraced with caveats. So let me give you an example. I think one of the proposals that has been focused on by the Republicans as a way to reduce costs is allowing insurance companies to sell across state lines. We actually include that as part of our approach. But the caveat is we've got to do so with some minimum standards, because otherwise what happens is that you could have insurance companies circumvent a whole bunch of state regulations about, basic benefits or what have you, making sure that a woman is able to get mammograms as part of preventive care, for example. Part of what could happen is insurance companies could go into states and cherry pick and just get those who are healthiest and leave behind those who are least healthy, which would raise everybody's premiums who weren't healthy, right? So it's not that many of these ideas aren't workable, but we have to refine them to make sure that they don't just end up worsening the situation for folks rather than making it better. Now, what I said at the State of the Union is what I still believe. If you can show me, and if I get confirmation from healthcare experts, people who know the system and how it works, including doctors and nurses, ways of reducing people's premiums, covering those who do not have insurance, making it more affordable for small businesses.
Politicians love telling voters that they're fighting for them, but governing requires actually sitting down with people you disagree with. However, Obama's response is where this exchange gets interesting. He essentially says, "I've already looked at your ideas." That immediately changes the dynamic. Obama doesn't simply dismiss Blackburn. He doesn't say Republicans have nothing to contribute. Instead, he points to a Republican proposal he says his administration was willing to consider, allowing insurance companies to sell policies across state lines. For conservatives, that is a significant point. Selling insurance across state lines has long been associated with the idea of increasing competition. If insurers can compete across a broader market, the theory is that consumers could have more choices and potentially lower prices. But Obama raises a legitimate concern. What happens if insurers simply move toward states with the weakest regulations? What happens if companies design policies specifically to attract healthier customers while avoiding people with expensive medical conditions? That's where Obama's argument deserves attention, even from conservatives. You can believe in free markets and still recognize that markets operate within rules. The conservative response shouldn't be, every regulation is evil. The better question is, which rules actually protect consumers and which rules simply protect entrenched industries? That's a much more serious debate. Obama then challenges Republicans to bring him alternatives. If you have a plan that lowers premiums, show it. If you have a way to protect people with pre-existing conditions, show it. If you can help small businesses provide insurance, show it. If you can expand coverage without creating unnecessary government bureaucracy, put the proposal on the table. That part of the exchange is important because it moves the conversation away from political slogans and toward actual policy. And this is where I think conservatives should be willing to criticize our own side. If Republicans say government health care is the wrong answer, then Republicans need to explain what the better answer is. Don't just say Obamacare is bad. Explain how you would replace it. Don't just say lower premiums. Explain how you would lower them. Don't just say more competition. Explain what reforms would create that competition. That's what serious governing requires. But there is another part of Obama's response where I think he makes an even bigger point. He argued that Republicans had portrayed his healthcare proposal as something far more extreme than what was actually contained in it. And whether you support Obamacare or not, that criticism deserves examination.
Having insurance reforms that ensure people have insurance even when they've got pre-existing conditions, that their coverage is not dropped just because they're sick, that young people right out of college or as they're entering into the workforce can still get health insurance. If those component parts are things that you care about and want to do, I'm game. And I've got I've got a lot of these ideas. The last thing I will say, though, let me say this about healthcare and the healthcare debate, because I think it also bears on a whole lot of other issues. If you look at the package that we've presented, and there's some stray cats and dogs that got in there that we were eliminating. We were in the process of eliminating. For example, we said from the start that it was going to be important for us to be consistent in saying to people, if you can have if you want to keep the health insurance you got, you can keep it. That you're not going to have anybody getting in between you and your doctor in your decision making. And I think that some of the provisions that got snuck in might have violated that pledge. And so we're in the process of scrubbing this and making sure that it's tight. But at its core, if you look at the basic proposal that we put forward, that has an exchange so that businesses and the self-employed can buy into a pool and can get bargaining power the same way big companies do, the insurance reforms that I've already discussed, making sure that there's choice and competition for those who don't have health insurance. The component parts of this thing are pretty similar to what Howard Baker, Bob Dole, and Tom Daschle proposed at the beginning of this debate last year. Now, you may not agree with Bob Dole and Howard Baker, and certainly you don't agree with Tom Daschle on much, but that's not a radical bunch. But if you were to listen to the debate, and frankly how some of you went after this bill, you'd think that this thing was some Bolshevik plot. No, I mean, that's how you guys presented it. And so I'm thinking to myself, well, how is it that a plan that is pretty centrist, no, look, I mean, I'm just saying, I know you guys disagree, but if you look at the facts of this bill, most independent observers would say this is actually what many Republicans, it is similar to what many Republicans proposed to Bill Clinton when he was doing his debate on health care. So all I'm saying is we've got to close the gap a little bit between the rhetoric and the reality. I'm not suggesting that we're going to agree on everything, whether it's on health care or energy or what have you. But if the way these issues are being presented by the Republicans is that this is some wild-eyed plot to impose huge government in every aspect of our lives, what happens is you guys then don't have a lot of room to negotiate with me. I mean, the fact of the matter is that many of you, if you voted with the administration on something, are politically vulnerable in your own base, in your own party. You've given yourselves very little room to work in a bipartisan fashion because what you've been telling your constituents is, this guy's doing all kinds of crazy stuff that's going to destroy America. And I would just say that we have to think about tone. It's not just on your side, by the way. It's on our side as well. This is part of what's happened in our politics, where we demonize the other side so much that when it comes to actually getting things done, it becomes tough to do. Mike?
Political rhetoric can become so exaggerated that people stop debating the actual policy. Everything becomes socialism. Everything becomes communism. Everything becomes tyranny. Everything becomes the destruction of America. And here's the problem. When you tell your voters that the other person sitting across the table is literally trying to destroy the country, what happens when you need to negotiate with that person? Your own voters may accuse you of betrayal. That's the political trap Obama was describing. And here's where I want to push back against Obama, too, because this problem absolutely isn't owned by Republicans. Democrats have done it as well. Conservatives have been called extremists, racists, fascists, threats to democracy, and every other political insult imaginable. So if we're going to criticize Republicans for demonizing Democrats, we also have to criticize Democrats when they demonize conservatives. You cannot demand civility only when your side is being criticized. That's not bipartisanship. That's political convenience. The real lesson here is that both parties have discovered something incredibly powerful. Outrage gets attention. Fear gets clicks. anger gets donations, and telling voters that the other side is an existential threat can be much easier than explaining a complicated policy proposal. But there's a cost. Eventually, Americans stop trusting politicians. Congress becomes more divided, compromise becomes politically dangerous, and lawmakers become terrified that one vote with the other party will be turned into a campaign attack ad. That's exactly why this old exchange remains fascinating. Blackburn was essentially saying, "We have ideas, let's work together." Obama was essentially responding, "Then bring me the substance, because some of your ideas may actually be useful." That's not the exchange you would expect if the caricature of the debate were completely accurate. And from a conservative perspective, there's another lesson here. Republicans should never be afraid to challenge government expansion. That's part of the job. But challenging government expansion is not the same as refusing to govern. If conservatives believe markets can solve a problem, prove it. If competition can lower prices, demonstrate how. If states can create better healthcare systems, explain why. If private insurance can provide better coverage, build a framework that makes it possible. Don't surrender the policy debate to Democrats simply because you're afraid of compromising. At the same time, conservatives should never accept the idea that every government program is automatically the solution. Government programs can become expensive, bureaucratic, and difficult to unwind. So the real debate shouldn't be government versus no government. It should be what actually works, what gives Americans more freedom, what lowers costs, what protects patients, what increases competition, and what gives families more control over their own healthcare decisions. Those are the questions politicians should be answering. And that's ultimately what makes this exchange so interesting. Obama wasn't simply defending his healthcare plan. He was making an argument about the political environment itself. He was saying that if politicians spend all their time telling Americans that the other party is evil, eventually they eliminate the political space necessary to actually negotiate. And whether you're a Democrat, Republican, independent, or conservative like me, that's a problem worth taking seriously. Because America doesn't need politicians who agree on everything. America needs politicians who can disagree without treating every disagreement like the end of civilization. We can fight over healthcare. We can fight over taxes. We can fight over immigration. We can fight over energy. We can fight over spending. But eventually, somebody has to produce results. And if conservatives want to lead, we need more than outrage. We need solutions. That's the biggest takeaway I have from this exchange. Marsha Blackburn was right to demand that Republican ideas be taken seriously. Obama was right that ideas should be judged on their actual consequences rather than political slogans. And both parties should have listened more carefully to the warning about demonizing political opponents. Because once compromise becomes betrayal, democracy becomes a permanent battlefield. And that's not conservative. That's not liberal. That's simply dysfunctional politics. So here's the question for you. Was Obama right when he argued that extreme political rhetoric was making bipartisan compromise almost impossible? Or was he simply using that argument to defend a healthcare proposal that conservatives had legitimate reasons to oppose? Let me know what you think in the comments. If you enjoyed this breakdown, hit the like button, subscribe to the Blue Brief, and turn on notifications because we bring you political commentary without pretending every politician on our side is automatically right. Let's get into this.